Hello, everybody. Dr. Dan Yachter here for news, views, and weekly updates every Wednesday, bringing you hopefully valuable information as it pertains to your health. We many times talk about what's on the health landscape, what you want to be looking out for, some of the newer topics, most recent headlines, and all the news that's fit to print. I'm going to change gears just a little bit today and really circle back to the brain masterclass content because I feel that it is incredibly important, incredibly valuable, and worthy of a review. So we're going to circle back around to the content that I covered last Tuesday at our masterclass, our sold out fixing or healing your broken brain masterclass. It was phenomenal. And I'm going to share some of the most important insights from that masterclass on this live segment. Before I jump in, two announcements, one of which you're invited if you'd like to come. August 19th, 6:30 p.m. That's a Tuesday night right here at the office. Going on almost 30 years of teaching these master classes, we're going to be talking about how to build a titanium immune system, aka how to raise a healthy drug-free family. You will learn about, good afternoon, CC. Good to have got some folks coming on board here. You're going to learn about the strategies that I have used to raise incredibly healthy children, an incredibly healthy family. And I consider my family to be one of the healthiest families in the community. And you're going to learn about all the strategies that we do. I take care of hundreds and hundreds of families, if not thousands of people, but hundreds of families at my office. And just like I was talking to someone, I was talking to a mom this morning, parents want to know how to raise a healthy family, what to do if and when a crisis hits. What do you do, Dr. Yachter? What do you do for your family? What do you do in this situation? What would you do if these were your children? And that's what I always talk about. I don't give medical advice necessarily, but I help empower parents, moms, as to what I would do if it was my children. And of course, I have raised my children health-wise very different than the rest of the community. I am an outlier when it comes to raising my family in regards to my health decisions and health choices because primarily of my health philosophy, which is not your standard conventional type of health philosophy. So I was just standing about an hour and a half ago with a mom asking me, there was something going on with the daughter and was very uncertain as to what to do. And I was sharing it with, she's like, I just want to know what you would do with your kid. If this is your daughter, what would you do? So again, that's the purpose of that master class. I lay out all of the strategies that we employ in my household under my roof every single day, every week, every month, every day of the year that we use to keep our family, our household healthy. And when we run into a crisis, what do we do? What do I do? And where does my confidence, conviction, and commitment come from? Well, it primarily comes from a deep, thorough understanding of not just the human body, but the power, the innate wisdom, the inborn wisdom which resides inside of the body. I have a very different lens at which I look at the human body compared to a medical doctor. Doctors of chiropractic look at the body very, very differently. If you know me from the community, if you're a patient or you just know me from the community, if you have a conversation regarding health, very quickly with me, if you have a conversation, you get into a conversation, you will know immediately that I have a very different philosophy, perspective, and just outlook on health and well-being, especially when it comes to children. So it's going to be, again, August 19th, 6:30 p.m., right here in the office, how to raise a healthy drug-free family or building a titanium immune system. Whether you're active, inactive, or just a guest of the office, you've never been here, you're just part of the community, come join us. This is wide open, free, no charge to the community, a master class that I've been delivering for almost 30 years of clinical practice. The other announcement I was going to make, I have created, based off of the master class content that I teach each month, I've created these easy to use, visual appealing, beautiful guides, these 8-page, 10-page guides of the content that I teach each month. So I package it, I kind of wrap it into a nice little bow there into these guides. I have one on the gut, a GI gut guide, heart, hormone, immune system, cancer prevention. We We have a brain guide coming out, and these are all available. And I'll place the link into the group here and into the page that we're broadcasting from. I'm going to post a link where you can go and you can order these guides. They're phenomenal, and it really takes all the information, condenses it into a beautifully packaged, easily presented, and easily understandable guide. And so they're there for you. And I just wanted to bring that up. I'll put the link here, easily get them. If you come into the master classes, you can get them for free, but you want to get your hands on these guys. They're phenomenal. So what I want to do is, I mentioned a moment ago, I want to circle back around to the brain masterclass content. Some very, very important stuff there. Just as a review of what we talked about, some of the content. Again, at the masterclass, we talked about building a better brain. You don't need perfect, you just need a plan, and you need to stick to it consistently. And really the big picture is that we're not just fighting a disease. Really what we're trying to do with getting this content out, which, teaching these master classes, building lifelong brain power and not fearing brain disease, because brain diseases are scary. They're my biggest fear when it comes to health problems. Not cancer, not heart disease, not heart attacks, not strokes. My biggest fear are brain diseases. I do not want to get Alzheimer's or Parkinson's or any of the 100 categories or subcategories of dementia. You've likely seen brain decline in your family. Most people have, maybe even felt it yourself. And again, the information, the reason I'm going back through the masterclass information, it's really designed to give the community what they need to interrupt that pattern. Maybe you've seen like what you would consider a genetic curse and interrupt it for good. It used to be 10, but 1 out of 9 adults over the age of 65 has Alzheimer's. Brain degeneration starts 20 to 30 years before diagnosis. 2 out of 3 Alzheimer's cases are women, and Parkinson's disease, a motor coordination disease that usually ends up pairing up with Alzheimer's. Unfortunately, Parkinson's affects over 2.5 million Americans every single year. It's not just aging, it's about inflammation. We're going to get into inflammation. And if it's inflammation, if these are inflammatory diseases or inflammation-driven diseases, they're modifiable. They're preventable, because inflammation is created by lifestyle, the way we live. Just basically the way we choose, what we decide to do on a day-to-day basis. So what's really going on with these brain diseases is that your brain shrinks, particularly the hippocampus. When we talk about memory, dementia, Alzheimer's issues, particularly the hippocampus. The hippocampus, your memory bank, interestingly enough, the hippocampus is, it's the seat of memory, mainly short-term memory. But the main reason that memory center of the brain shrinks is because of things that you may have heard of before, things called amyloid beta plaque or beta amyloid plaquing, neurofibril entanglements or neurofibrillary entanglements. These are basically, think of like jellyfish clumps, the tentacles coming off a jellyfish. Those are the neuronal or axonal, the dendrites, the connections between brain cells get all clumped up. Amyloid beta plaquing is the gunking up of brain matter. The neurons get all tangled up. And yes, poor lifestyle choices are at the center of the discussion. And it's inflammation because of poor lifestyle choices, the way we think, eat, move, all these things affect, basically your short and long-term brain health. So the key terms that we talked about at the masterclass, one being BDNF, brain-derived neurotrophic factor. Brain-derived neurotrophic factor is a protein. It's like miracle growth for the neurons of the brain. You raise it with exercise, fasting, intermittent fasting, curcumin, omega-3s, DHA, EPA. Many of you guys are taking that out there. And so the reason why BDNF is so important is because, again, it helps strengthen existing neurons, makes them stronger and healthier. It creates stronger connections between existing brain cells, and it also helps grow new ones. And it also strengthens neurotransmitters, acetylcholine, which is for memory and focus, which is destroyed by many medications. Neuroinflammation is the spark that lights the fire of brain degeneration. Some of the brain killers, beware of them. Many common prescription and over-the-counter drugs shut down your brain's communication system. We talked about this in the master class. Things like Benadryl and Tylenol PM, Aleve PM, antidepressants, antipsychotics, bladder medications, and Parkinson's drugs. All these medications are shown to ignite massive inflammation of the brain and perpetuate brain disease. We now know, many of you guys have heard of this before, is that there's a lymphatic system in the body. The lymphatic system is the gutter system of the body, collects toxicity, and by way of your liver, helps flush it out of the body. But in the brain, it's called the glymphatic system. The glymphatic system primarily works while you're sleeping. And while you're sleeping, what it does, the glymphatic system is like a circulatory system. The brain actually has its own circulatory system, and that's the CSF, the cerebral spinal fluid. While you're sleeping, it flows in unison with the heartbeat, and it flushes or brings nutrition up, flushes toxicity out. It's a circulatory process. What's been shown to inhibit that washing of the brain while you're sleeping are, believe it or not, sleeping medications interfere with the enzymes involved with washing and clearing the brain of these entanglements, of degeneration, of inflammation. And so there are things like medications that could get in the way of your brain staying healthy and being washed primarily at night, the glymphatic system. So if you're using these medications daily, some use them daily for years, you're loading the brain with dynamite. You're loading your brain with dynamite. The brain healers, we talked about at the master class, food and habits that degunk, de-inflame, and rebuild the brain. Broccoli, cauliflower, loaded with choline, pasture-raised eggs loaded with acetylcholine for memory and many other critical brain functions. Wild-caught salmon and smash fish, sardines, mackerel, anchovies, salmon and herring. These have tremendous benefit for the brain's anti-inflammatory, omega-3, DHA, EPA. Wild-caught salmon, berries loaded with polyphenols, anti-inflammatory, antioxidants, drive brain inflammation down. Berries of all kinds. Pink Himalayan salt, very important for many reasons. I can go into reasons for gut health. There's a lot of reasons we want good salt. Pink Himalayan salt is the one I recommend, or Celtic or Celtic salt. I don't like, there's some salts out there, not necessarily that good, but pink Hawaiian volcanic type of salt, that's really what you want to get. Better than Himalayan, actually, but nonetheless, a good earth mineral salt containing well beyond 30 or 40 micro and macro minerals. Curcumin is phenomenal. It increases BDNF, that brain fertilizer. BDNF, again, is miracle growth for the brain cells, and it decunks the brain. Curcumin and fish oil naturally raise BDNF, the brain fertilizer, the miracle grow. EPA, DHA, eicosapentaenoic acid, docosahexaenoic acid, those EPA and DHA, they are incredibly anti-inflammatory for the brain, and they raise BDNF. Magnesium threonate is the best form of magnesium out of the 6, 7, or 8 different types of magnesium. It's able to cross the blood-brain barrier, reducing brain inflammation. Bacopa, ginkgo, carnitine, these are the things that I recommend to my patients. They support memory and dopamine production. Dopamine is important for focus, alertness, and attention. Lab testing. We're going to go through the most vital lab marker. I consider it the most vital lab marker. I'm going to talk about that right now. How do you test it? How do you track it? But if you want to win the war, the brain war, you got to test. Don't guess. You got to test. There are essential labs to track that are known as harbingers for either you developing future brain diseases or preventing them. Omega-3 index, which we're going to talk about quite a bit right now, coming up. GI map, gut-brain axis insight to understand how your gut could be affecting the brain. Vitamin D, we talked about it at the masterclass. Blood sugar, they're calling Alzheimer's type 3 diabetes. So you want to know your blood sugar markers. I'm going to cover those before I sign off today. CRP, homocysteine, interleukin 6. These are all inflammatory markers that can give you a good picture of whether or not your brain is inflamed or you have an inflammatory issue in the brain. So to stay sharp, some of the key points I brought up at the Fixing or Healing Your Broken Brain Masterclass were, number one, align the spine. Chiropractic isn't just for backs. It's misalignments. If you have them in your neck, particularly, create tension on the brainstem, the nerves, the spinal cord, create inflammation, cognitive chaos. So start with your atlas. Have your upper spine, your upper cervical spine checked by a chiropractor. You have to heal the gut. You got 100 trillion gut bugs. They make serotonin, dopamine, GABA. They make neurotransmitters. If they're sick, if your gut is imbalanced, if you have an imbalanced or dysbiotic gut, if they're sick, if your gut microbiome is sick or imbalanced, your brain's toast. Okay. So fix the low acid. We talked about removing inflammatory foods, supporting digestion with enzymes and fermented foods. But ultimately, you want to run a GI map. Eat with purpose. Your brain craves colorful foods, good brain fats. The brain's 60% fat, like feeds fat. You want to feed your brain good fats, saturated fats, monounsaturated fats, and minerals. Talked about the good fish, salt, fermented foods, olive oil. Move every day. We'll talk about this next week, how movement cranks up the production of BDNF, brain-derived neurotrophic factor, the miracle growth for the brain. We'll talk more about intermittent fasting, the immense benefits, brain healing benefits of intermittent fasting, and how it raises this brain fertilizer, this miracle grow known as BDNF, brain-derived neurotrophic factor, a protein that's increased when you intermittent fast that strengthens your brain. Detoxification, we'll talk more about this. Sleep, toxic, medication elimination when possible. So we're going to talk more about some of those things that I went through very quickly, but the main thing that I wanted to focus on today is the most important blood marker I feel as a clinician when it comes to near and long-term brain health, a really important one, and that is the omega-3 index. If you don't know what your O3 index is, you want to find out. Maybe when you go for your next annual physical, ask the doctor, I want to know what my omega-3 index is. They may have to go to the internet and Google it. Your medical doctor typically is unaware of what this is, but we know a lot of research shows, for example, a research study that was conducted, a widespread study of 485 people age 55 and over, showed that those who took fish oil, DHA, they took them for 6 months, demonstrated significant improvements in memory and learning. The study also showed that the higher the DHA intake is, it's inversely correlated with the relative risk of developing Alzheimer's disease, which means the more fish oil you take, the less likely you are to get Alzheimer's disease. The Framingham Heart Study, the highest level of fish consumption had 50% less Alzheimer's rate. Omega oils protect the brain and shut down brain inflammation. So again, you can find out what your number is by doing the omega-3 index test. In our office, we make it super easy. What we do is we have a little finger prick. It takes like 2 minutes to do. It's around $50-$60 to do. And we get a couple of drops of blood, mail it in like a postcard, get it back. We do this routinely for our patients. And it's the inverse of hemoglobin A1C. So if you ever had your hemoglobin A1C checked, a blood sugar marker, which they use to determine whether you're a diabetic or not, I'm going to have the omega test done. Yes, great test. Good one to get, Carol. So what it does is, like hemoglobin A1C, the lower the better. Like 5 is like optimal. What hemoglobin A1 shows, the hemoglobin A1C, is how sticky are your red blood cells. We all have sugar floating around our blood, but you only want so much, and so much sticking to your red blood cells. And it's looking at the cell membrane, how much sugar is sticking, or how much of the cell membrane is made of sugar, right? The lower the better. With the omega-3 index, same concept. How much of the membrane is constructed of omega-3, DHA, and EPA, but the higher the better. In fact, the optimal or stellar place to be would be 8 to 12%. So again, the percentages, they're inverse. They're going to the opposite direction with hemoglobin A1C and the omega-3 index. So it's really important that you get that dialed in. And it's not just, we're talking about why it's so important for the brain. Part of the reason is that it de-inflames and degunks the brain, raises BDNF. It does all the things that you want to see happen to produce and maintain a healthy brain. So if it reduces inflammation in the brain, it's going to do the same thing in the body. And when we talk about, for example, autoimmune diseases, whether it's eczema, psoriasis, brain diseases, you could have things like MS. These are autoimmune diseases, Hashimoto's thyroiditis, Graves' disease, rheumatoid arthritis, lupus, in the gut, irritable bowel disease, bowel diseases of all kinds, colitis, Crohn's, all of these different things, especially skin diseases, eczema, psoriasis, all of these are autoimmune in nature, and everything autoimmune is driven by inflammatory levels in the body, okay? Especially arthritis and swelling and different pain syndromes, all driven by inflammation. And I can tell you there's a lot involved when the system's off balance like that. But when that's happening, I tell all my patients, just make sure even if you're taking supplements, even if you're taking fish oil, you have to really optimize that omega-3 index. And the only way to optimize it is to know what it is. So if you're concerned about your brain, especially your body, inflammatory levels, get that omega-3 index done. Super, super important. Higher omega-3 index is associated with larger brains and better cognitive function. That was the summary of the Framingham Heart Study. The MRIs of lower brain volume in those with an omega-3 index under 4.4 represents a change equivalent to approximately 2 years of structural brain aging. Your brain ages significantly faster if your omega-3 index is under 4.4. Again, optimal 8 to 12% to protect your brain. The most important marker and the most important supplement you want to have and want to know about for your brain. That was published in the Journal of Neurology in 2012, Tan et al. So hopefully this information has been helpful. Hopefully, you understand the importance of the omega-3 index. Have your medical doctor put it on your next panel, or if they won't, or you can't get that done, find out through us and we'll do it for you. It's a really cheap blood marker to get. And so the other thing that you really want to track, or the other marker, are your blood sugar markers. Hemoglobin A1C, fasting blood glucose, and insulin. The most important number out of those three markers is your insulin. But what the studies show, along with the omega-3 index and the importance of it for long-term brain health, is a study published in the New England Journal of Medicine in August 2013 demonstrates that even mild elevation of blood sugar, a level of around 105 or 110 fasting blood glucose, is associated with an elevated risk for dementia. Neurology Journal, the Journal of Neurology, October 2014, proved memory function is directly affected by blood sugar. Higher blood glucose and insulin shrinks your brain, in particular the hippocampus, which is the memory center of the brain. There is a direct correlation between hemoglobin A1C and brain shrinkage as you age. These are hemoglobin A1C are harbingers, fasting blood glucose, insulin, harbingers to full-blown later life dementia, but it can be changed. It can be turned around. You can control these markers. Harbingers, predictors of things to come, okay, bad or good. So stay tuned to these segments, because next week, I promise you, I will give you the baker's dozen. Okay, I already gave you one, the most important brain marker you want to get and look at and track and manage and evaluate regularly year over year is your omega-3 index. But I'm going to give you the rest of those markers. Next week, I'm going to discuss the markers, how to get them all tested, and if they're off balance, how do you get them balanced? How do you control them through lifestyle intervention? What are the lifestyle interventions that you want to use? But again, I call them the baker's dozen. I gave you one today. There's 12 left over that we're going to be talking about next week. Find out what those are. In the meantime, if you want to get the omega-3 index tested through us, let us know. Message me, email me, text me, call the office, and we can get it done for you. So I'm going to sign off now, but remember, next month, August is coming up right around the corner. The 19th of August, 6:30 p.m., right here at the office. You are invited, whether you're a patient or not. The entire community is invited. Building a titanium immune system. How to raise a healthy, drug-free family. I'm going to teach you how I am raising an incredibly healthy family and the unorthodox things that I do for my family, my children. And you're going to learn about my health philosophy, really the chiropractic health philosophy, how we look to the great physician within to guide, lead, and heal. So be with us August 19th. We want you here. And in the meantime, I thank you greatly for joining us on this segment. Once again, our Wednesday news, views, and weekly updates. And if you're not part of our private group yet, then join My Family, My Mission inside of Facebook. We have tons of resources, videos, postings that you will not see anywhere else. You'll only get if you're part of that group, My Family, My Mission. Ask to join. We'll get you in there, and you can be part of our amazing health and wellness community. Almost 2,000 people part of that community. Again, everybody have a great Wednesday. Dr. Dan Yachter, the chiropractor, signing off. God bless.